Hello, everyone. This is Delbert. It's probably been about, I don't know, 8, 10 years since I recorded my last video. The previous series was about colon cancer and my taking the Folfox treatment. That treatment went well. I've been living right along, went well past my 5 year mark, and everything's fabulous. Over the last year, I've started to have what I thought was UTIs, and I went and saw a urologist, and they gave me a bunch of treatments, and they put me in for a couple of exploratory look-arounds in my bladder and such, and they've determined that I now have bladder cancer. The first biopsy they did, it didn't have enough muscle mass to determine if it was in the muscle or if it was just on the surface. In any case, they cleaned out the bladder, took away a couple of layers, and sent it off for a biopsy. And that went really, really well. Came back, and yes, I was confirmed that I do have bladder cancer, but they didn't know how deep it was. A few months later, that doctor, he went on to another practice, and I got a new doctor, and he wanted to go in and look around again and scrape off a layer and get better margins. He did his job, everything went well, and confirmation came back again that yes, I do have bladder cancer, and that it is not in the muscle, so it's just in the lining. And that procedure, while not comfortable, it's a hospital procedure, worked out fairly well. And now I'm a few weeks healing, and I have to go in for BCG treatments. This is where they take a cancer killing drug and they, through a catheter, they put it up in your bladder, and then you have to keep it in there for 2 hours and then evacuate it, and then wait another week. The normal treatment for this is once a week for 6 weeks. And part of this video is just to say, hey, I'm still here. This is not a went from colon cancer to bladder cancer, because I'm 10 years past my colon cancer. Everything's been going great, living my life, traveling the country, bought a new house. Everything is fabulous. Still working my job and everything else. So, there is life after cancer, and the goal of these latest videos is to explain what happens when you go through a BCG treatment for bladder cancer. I just did mine on Wednesday. This is Friday. I'm a little late in posting my video, but the procedure went this way. I went into the doctor's office, met with a couple of nurses. They took a urine sample and made sure I didn't have an infection of any kind. That came back clear. I went and I sat down in a room on a bed in there, and they stuck a catheter down through my urethra and into my bladder, and then they proceeded to drain out any urine that might be left in there, and then they put in this BCG treatment. No issues whatsoever in the whole procedure. Wasn't uncomfortable, wasn't any pain, but obviously anytime they put a catheter down through your urethra, there's that last little bit that isn't comfortable. The nurse was very, very nice. She said, if I would just breathe more, it would make it easier. But again, she did it, put the medicine in, pulled the catheter out. No anything. No sense of, oh my gosh, I gotta go to the bathroom. No, oh my gosh, this hurt. Just absolutely nothing. It went really, really well. Nobody wants to do this, but I just want to make sure that my voice is out there for anybody that needs to go through this treatment, that you can hear it from a normal person what I experienced. So put the medicine in, pulled the catheter out, I got redressed, didn't even really take off much, just dropped my drawers and sat down on that bed. Wasn't any reason to get truly undressed. She then said, okay, go home. The procedure when you get home is to go lay down on a bed and every 15 minutes roll a quarter of the way over. So in my case, I started by laying down on my belly. I don't like laying on my belly, so I figured I'd get that first 15 minutes out of the way, then roll to one side, wait 15 minutes, roll to my back, wait 15 minutes, and so on. I had practice because of the uncomfortability with my bladder and having to go to the bathroom so often. I had practiced days before to see if I was going to be able to hold for 2 hours. Again, not knowing what to expect from this treatment and them putting stuff in there and how much. But in any case, I made 6 different positions, roll, 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 roll. And then all of a sudden I started getting in my head that I had to go to the bathroom, So I'm watching my phone, I'm playing video games on my phone and just anything to keep my mind busy. Probably could do better at that. I'm going to practice next Wednesday to find a different way to do that to keep myself busy. So in the last half hour, I decided to divide that time in half. And the last 2 positions were only about 6-7 minutes each. Then I had to go to the bathroom, and that's I had to call the end of it. I kind of called it successful because it at least took me 15 to 20 minutes to drive home, and they say to keep it in you for 2 hours. Who knows? I think the next treatment I have, I'm gonna stay in every position for 10 minutes, and that will at least, maybe it'll get coated around the bladder a little better by having a shorter duration. I've read online that it's only some doctors that ask you to go home and do this rolling effect every 15 minutes. I don't know. I'm not a doctor. But in any case, I'm going to call this video done. The whole idea was just to get it out there. I will give you my experiences through the next few treatments, which again, every Wednesday, I have to do this about 10 o'clock in the morning. And I hear the third one, things start getting worse on your body because the goal of this medicine is to irritate the inside of your bladder lining so that it sheds away and your body fights off these bad things and all of this. Those of you who have been following me, I did, 6 months of Folfox treatment for colon cancer. So this is easier than that because you don't have to go in and sit for hours and hours and have this stuff put in your blood. This is just put the catheter in, shoot in the medicine, pull the catheter out, and go home and lounge around for 2 hours while you're flopping around or moving from side to side. If you have questions, put them in the comments and I'll be more than glad to answer them. If you're getting ready to go through BCG treatment, I hope my videos do you some good because I'm going to tell you exactly what I experienced. If it gets bad, I'm going to tell you that. The best thing for anybody going through cancer treatment is to have somebody tell you exactly what you can expect, to see it through somebody that's done it recently so that you can have a little bit more clarity in what you're going through. I hope this video gives you the information that you want. And until next time.